Welcome back to Britology. Today we're diving into a subject that touches millions of lives every single day in the United Kingdom. What's really going on with the NHS in 2025? The National Health Service has always been more than just a healthcare system. For many, it's a source of pride, a symbol of equality, and one of the most important institutions in the country. But in 2025, it's facing some of the biggest challenges in its history. To really understand what's happening right now, we need to look at the bigger picture, the problems, the changes, the politics, and the impact on ordinary people. Let's start with the reality that most people are seeing. If you ask patients about their experience, many will tell you the same thing. Waiting times are still far too long. Whether it's trying to get a GP appointment, waiting an accident, an emergency, or being placed on a waiting list for surgery, delays have become the new normal. Some patients are waiting weeks just to see a family doctor and months, sometimes even years, for procedures like hip replacements or cataract surgery. The pressure on hospitals has reached breaking point. And for patients in pain or uncertainty, this can feel unbearable. Behind these delays are multiple causes. The NHS is struggling with a severe shortage of staff, despite recruitment campaigns and promises to bring in thousands of new nurses and doctors. The system simply doesn't have enough people. Many staff who worked through the pandemic left due to exhaustion, stress, or better opportunities abroad. Those who remain are often stretched thin, working long hours and facing burnout. Junior doctors and consultants have staged strikes in recent years, demanding fairer pay and better working conditions. And while some agreements have been made, the tensions haven't gone away. Funding is another major issue. Every government claims to be investing more money into the NHS, but the reality is that the cost of running the service has soared. An aging population means more people need care, often for complex long-term conditions. New treatments and advanced technology save lives but come with higher price tags. And with inflation and rising costs across the economy, NHS budgets are constantly under pressure. Even when funding goes up, it often isn't enough to match the demand. Technology is both a challenge and an opportunity. In 2025, the NHS is rolling out more digital systems, from online GP consultations to AI-driven diagnostic tools. In theory, this should make services more efficient, but in practice, the transition hasn't always been smooth. Some patients welcome the convenience of speaking to a doctor on their phone, while others, especially the elderly or those without good internet access, struggle to adapt. At the same time, there are concerns about data security and whether technology is being introduced too quickly, without proper support for staff and patients. Another important part of the story is the rise of private healthcare. More people than ever before are paying out of pocket or using private insurance to get faster treatment. This doesn't mean the NHS is disappearing, but it does show a shift in public behavior. People who can afford it are choosing private hospitals to avoid long waits, while those who can't are left waiting even longer in the public system. For many, this raises uncomfortable questions about fairness and whether the NHS is still delivering on its original promise of free, equal healthcare for all. Politics, of course, plays a massive role. The NHS is always a hot topic in elections, and in 2025, it's right at the center of national debate. Different parties have different visions. Some argue that the NHS needs huge structural reform. Others focus on increasing funding, and some even suggest more partnerships with private companies. But ordinary people don't always see these debates as solutions. They care about whether they can get an appointment when they're sick, whether ambulances arrive on time, and whether hospitals are safe and well-staffed. It's not all bad news, though. There are still countless success stories inside the NHS. Every day, lives are being saved by dedicated doctors, nurses, paramedics, and support staff. Advances in cancer treatments, heart surgery, and genetic medicine are giving people hope where there once was none. Vaccination programs and public health campaigns continue to protect millions. And despite all the pressure, surveys show that most people in the UK still deeply value the NHS and want to see it survive and thrive. One of the most pressing questions in 2025 is how sustainable the NHS really is. Can it continue to function in its current form, or does it need radical change? Some experts argue that without major reforms, the system could collapse under the weight of demand. Others believe that with proper investment, better workforce planning, and smarter use of technology, the NHS can be restored to something closer to its original vision. The truth is probably somewhere in between. The NHS of 2025 is not the same as the NHS of the 1950s, and it can't be. Society has changed, medicine has changed, and expectations have changed. But what hasn't changed is the principle that healthcare should be available to everyone, no matter their income. That principle is what still makes the NHS unique and worth fighting for. If you look beyond the headlines, you'll find a complex picture. Yes, there are problems, serious ones. Staff shortages, underfunding, political arguments, and long waiting lists are very real. But there are also thousands of people working tirelessly every day to keep the system alive. The NHS is under strain, but it's not broken beyond repair. It remains a vital part of British life, and the decisions made in the next few years will shape its future for generations to come. So what's really going on with the NHS in 2025? It's a story of struggle and resilience. A system under immense pressure, yet still holding on. A workforce that is exhausted but still caring. A nation frustrated by delays but still proud of its healthcare service. The challenges are huge, but the hope is that through reform, innovation, and political will, the NHS can survive and adapt. And at the heart of it all is a question every citizen and every government has to answer. How much do we value our NHS? And what are we willing to do to protect it? Thanks for watching Britology. If you found this video informative, don't forget to like, share, and subscribe for more deep dives into the stories that matter most.